In the week that I was writing what I thought were the final lines of this book, I received a flurry of texts. What did you think about the manifesto? It was the fall of 2022, and a new version of the care standards for the international provision of transgender health had just come out. The organization that has published these guidelines for the past 4 decades was hosting its annual conference for healthcare providers in Montreal. During the opening session, one white transgender woman, a surgeon named Marcy Bowers, introduced another, pediatrician Rachel Levine, Assistant Secretary for Health for the U.S. Department of Health and Human Services. Before Levine could deliver her address, a group of transfeminine activists took the stage and the mic. They held a black banner with pink text spelling out the name of their collective, TRAPS, and read a prepared manifesto to the audience that had gathered to listen to Levine reflect on the state of trans health. In it, they criticized the organization's infantilizing and stigmatizing tradition of organizing exclusive conferences around trans health for doctors, psychiatrists, and other specialists far removed from our material realities. As they introduced their demands, they emphasized the prohibitive expense of accessing care. The moralistic and patriarchal stubbornness of doctors, scientists, and the state to regulate our bodies causes unacceptable, sometimes fatal violence. The financial burden of transition, the absence of transfeminist leadership in community and hospital settings, the underfunding of scarce resources for transfeminine people, and extreme discrimination in employment place us in a precarious situation. The group received a standing ovation from the audience. However, organizational staff hurried to stifle the message, turning off the event's live stream almost immediately and calling security. Nearly a decade before, in August 2013, I stood on the sidewalk in downtown Buenos Aires in front of the Hotel Bowen. I had come to Argentina to study how political organizing, health politics, and medical systems have shaped the emerging field of transgender health. The prior year, the nation had passed the gender identity law, which its proponents called the world's first depathologized law related to trans people. In other words, the law defines people seeking gender-affirming care not as ill, but as legitimately entitled to pursue such care of their own accord. Its provisions include access to trans therapeutic care based solely on what people say they need. As I will discuss shortly, trans therapeutics is a term I use to describe gender-affirming care that is specifically sought by trans people. In addition to changing paradigms of access, the law also addressed financing across the full healthcare system. At least on paper, access to coverage for trans therapeutics includes people who use the publicly funded safety net system for their healthcare, in addition to those with public or private health insurance plans. The passage of the law marked a significant change from earlier models of care, which required lengthy psychiatric evaluation and a diagnosis of what at the time was called gender identity disorder.